We stand up to defend and protect Medicare and the principles of healthcare being a right, not a privilege. Co-payments would result in decreased access to healthcare and people delaying treatments, leading to higher healthcare costs overall.
This is bad for health, it's bad for people, and it's bad policy.
We have to tell the Abbott government to get its hands off our universal healthcare insurance system.
Co-pay, no way. This union won't back down. Privatisation will undoubtedly lead us to an Americanised system.
I can assure you that the model we are putting forward is in the community's interests. It is partnering with the private sector. It is partnering with the private sector.
We are on a slippery slope for a profit-style model like the United States health system.
The most important issue is what we're going to be able to offer our patients. You have to remember the bottom line for any private company is profit, 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 profit.
We are door knocking because we want people to be aware that this new hospital on the Northern Beaches is going to be a private hospital with public funded beds. We're just seeing what everybody thinks about that.
Their number one request of our state government is to introduce nurse to patient ratios. Labor will deliver them and we'll go further. We'll legislate those ratios in government.
We'll continue to campaign for safe patient care right across New South Wales.
Our patients are suffering, they sense that our nurses are stressed. So we're trying to get our 1 nurse to 3 patients mandated in emergency.
1 to 3 NED.
We wanted to give Mrs Skinner a message that we're actually not going to give up. We're going to keep fighting for ratios and for safe patient care in all our public hospitals.
Health Minister, it's time to deliver safe patient care.
We're sacrificing our own time with our own families to care and look after the patients that need our assistance.
Hands up! Hands up! Hands up!
I'm a nurse and I've got a lot to say. I'm here today because I'm sick of being taken for granted, and I want this federal government to actually listen to those of us who work in industries that provide 24-hour service. And we are here to say, hands off our penalty rates.
It's not about what we want as individuals, it's what we want as a group of people. And having a larger group gives us more power in terms of how we can negotiate in the agreements that we seek for all members.
May Day is a fabulous day every year for all unions to come together and be united in solidarity for our causes, which are to maintain our union rights.
If you don't have that registered nurse support in an aged care facility, I see that as being a very big threat.
It's just unthinkable that you wouldn't have a registered nurse there who's able to execute sort of a higher reasoning of decision making.
We need those registered nurses.
Collecting signatures with people that are coming to the seniors concert and asking them to sign to support that we keep registered nurses in nursing homes.
I think they're losing sight of what the word care means if we don't have registered nurses.
Are registered nurses really essential? Very short answer, yes.
RN 24/7.
The government is saying that they're giving people choice, but in fact they're not giving them choice. It's really scary, and we're seeing good staff now just walk out the gates.
A real choice is public owned and funded disability services.
Very proud to be part of this flotilla of nurses that have come all the way up the south coast of New South Wales, through the north coast, central coast and up to Brisbane here to lobby our leaders for the G20.
Yes, we're here to make sure that public health care is well financed worldwide. And how do we do that? It's through a Robin Hood tax.
Your
private health insurance doesn't seem to cover anesthesiology.
We want a fair go for all, and we will do everything in our power to defend our living standards. As frontline health professionals, we feel strongly about our universal health system. It should not be undermined by any government.